Hey Ohana, welcome to Conversations with a Chiropractor. We have Dr. Sean McTaggart here, and he's going to answer a few common questions for us, and he's going to help us break down some of our volleyball videos and how chiropractic can help us.
Hi guys, my name is Dr. Sean McTaggart. I'm a chiropractor here at Menlo Park. I grew up in the Bay Area, San Mateo, California. Our office is located near Stanford, right off 280 in Sandhill. Thank you for having me, and I'm ready to answer some questions.
One of the most common things was, my daughter isn't injured enough to go to a chiropractor. Is it worth it to go in even if she's not experiencing any type of pain or she's not extremely injured?
This is a common question I get, guys. Something that I answer pretty much every day. This is kind of like the introduction I give to most of my new patients. Maybe some of you have heard this, some of you haven't. I'm very similar to what I call like a mechanic. So in terms of what I do is I'm a mechanic of the body. And what I do is, if you've never been to a chiropractor, you probably never had your joints assessed. It's like an algorithm for me. So I start with the ankles, I work my way all the way up to the top bone in your neck, a full body chiropractor. In terms of like if your daughter's never had one and she's going through, you're putting your body through range of motion, you're pushing yourself to the limit. And as a chiropractor, my main thing is I don't want to be playing catch up. Right? A lot of my patients, they come in when they're already hurting. And what that means to me is that I have to get them to the optimal functioning of their biomechanics. Sometimes that's a little too late. When you're playing sports, that starts a wear and tear process. So what my big goal is to change the narrative from a catch-up kind of get you into the right place. I want it to be a preventative. I want you to come in when you're not hurting. That way we can both assess what's going on, how you're feeling, what's bothering you, if there is anything. Just to kind of answer your question, I want to switch it from a catch-up to a prevention kind of care that I provide.
I think too, something that you said about prevention, the rhetoric of healthcare and the healthcare that we're receiving is definitely changing. Instead of just being reactive, like you said, we're trying to be preventative, stay at our top shape instead of waiting till we get hurt and then going to get help. So I definitely think that preventative care is the new thing, and it's changing within the world of sports and the world of healthcare, definitely. So that definitely leads into our next question of, do you have to go see an MD before coming to you?
So definitely not. Chiropractors are a primary portal of entry care. MDs, okay? MDs great. They do a lot of things that I can't do. But as a chiropractor, you do not have to see an MD first. In fact, if you have an injury or you have something that's bothering you, you're not going to get your answer at an MD. In terms of being an athlete, a young athlete with some sort of nagging injury, or something like that, I am the first person that you should come see. And if I always have this rule, if I can't help you, I will get you to someone that can. I definitely think that I am the first person that you see for minor injuries, for stuff like that. Absolutely.
Yeah, and a lot of the questions that were asked are, you considered a doctor, and how did you get to where you were? How was the schooling, the training? How many hours did you have to put in?
Well, it was a lot. It was a ton. Schooling was tough. I am a doctor. I like I said, I'm a primary portal of entry, which means you don't come to me for the big stuff, but you come to me for the everyday stuff. The things that aren't getting better based off the answers you received from a medical doctor. Started when I was 12 years old, wanting to become a chiropractor. I decided to go to college for kinesiology. I went to Sonoma State, and that was a four and a half year program for me. And then I jumped right into chiropractic school. I got a letter of recommendation. I literally graduated in April, and I started in June. This is the best job in the world for a reason. I get to help people, and I look forward to it every single day.
One of the things that I worry about as a coach is the repetitive movements of volleyball. There's a lot of jumping, there's diving, and those are big impact things on the ankles, on the knees, on the back. So I would like to ask you about repetitive movements and what that means for your body and why that can lead to injury and where you come in.
That is an excellent question. There's only two ways that the body becomes out of place. The fancy word we use is subluxation. One of them is trauma, so like a car accident or like a football player, right, getting hit, right? That's trauma. The second one is exactly what you said. It's repetitive motion. The muscles, what they do is they have a memory. Muscles attached to bone. So if you are out there swinging with your left hand or your right hand over the top and say, 100, 150, 200 times during a practice, that starts to take a toll. That's what we call repetitive motion. That's what we call wear and tear stress on a joint. Where I come in is I assess that motion, right? With a chiropractor, I have the ability to fix that joint. That's kind of what we do in a nutshell. Your body has a way of remembering how you get out of bed, how you get out of the car, how you put on your shorts, how you sleep. So I use it as I'm a big reset button for your body.
So hopefully the goal is to get more athletes to you and just to educate more people. A lot of people just haven't been around this world for a long time and haven't been exposed. I know personally it changed my life. My first time I was extremely nervous. I was scared. I had never done it before. He walked me, to anyone who else is nervous who's watching this, he walked me through the entire process, didn't do anything I wasn't comfortable with. So not only does your body feel better, this has a huge effect, I want to say, on the psyche. You know, like you said, you love what you do, but just seeing people feel better, you know, why don't you talk about how this can help you mentally and emotionally? What are the benefits?
I know that I'm talking directly to your athletes, but some of your players have also brought in, you know, their grandparents, their aunts, their uncles. There's a cheesy saying in chiropractic that if you have a spine, to be checked out. Part of it's true, and part of it's part of that cheesy process. Because in terms of you know, chiropractic, if you really aren't doing anything, who knows if you need me? Right? I'm not here to tell you differently. But if you are active, and a lot of your players are, a lot of your parents' families are, from what I've seen, you need to be checked out. I call it the 10,000, 50,000, 100,000 mile tune-up for a reason. Exactly what it is. It's a tune-up.
So our Ohana experience has been really great at Peak Performance. We definitely want to continue to educate our families and continue to bring people in. Feel free to email us at Ohana. If you have questions for Dr. Sean, we can push those questions to him. Thanks for joining us and watching our conversation today.
Thank you, guys. Once again, thank you for having me. I'm looking forward to meeting all of you, hopefully. Please stop by if you are in the area. Like I said, we're in Menlo Park. I'm wishing you nothing but the best. Have a great day, and I'll talk to you guys soon.
Thank you.